Sleep, especially as a parent, you know how important it is, not just for your child, but for you as well. Now, for years, parents have been trying all kinds of things to help their kids sleep, including the sound machines. Now, there's a new report out from the American Academy of Pediatrics indicating that sound machines, if not used properly, could actually be causing damage to the young one's ears. So let's talk about it. Hey everybody, it's Dr. David. I hope you're having a great day. As a parent who, especially for our first child, went through all kinds of sleep issues and really needed to do anything as possible. We actually found techniques that included more just soothing music than sound machines, but we certainly would use anything that we possibly could to get our child to sleep. Now, before I go into this new policy statement that's been put forth by the American Academy of Pediatrics, I wanted to review not just why this is important, but also in particular for children. And part of the issue is that especially young children, because they have such smaller ear canals, it concentrates the sound into a much more smaller stream, as you can imagine. And so it's kind of hitting more at a single point with into that more concentration because it's all going through that smaller tube as opposed to a relatively bigger tube that an older child or an adolescent or an adult has. But especially in the infants, who usually the sleep is the worst problem, or at least the toddlers, that really small canal is one of the things that could actually lead to the same amount of decibels causing more problems. Okay, now as far as unsafe listening, now it is estimated that over 1 billion children in the world are at risk for hearing damage because of what they're hearing, the volume of what they're hearing. And really, and about 60% of adolescents are also at greater risk of the hearing loss, and especially when you're talking about music, whether they're going to for a dance party or going to concerts. Of course, there could be very high decibel levels that are being hit there. Now, if a daily for 8 hours, even for a decibel of 85 decibels, that could be enough if it's 8 hours like every day, which is not the acute damage. I'll talk about that in a moment. But in terms of the long-term damage, even a daily exposure for 8 days. So, if somebody is, if a kid's classroom where they live is like close to a roadway where there's all kinds of trucks and stuff that's going by, sirens, etc. So even where people live can make a difference. Now, overall, 85 is the decibel level that should not be exceeded by anybody on a regular basis, but in particular for adults, and I guess say older adolescents as well. But if it's felt that really you should not be exceeding 80, like 72 to 80, some people say even less than 72 is where you should be kept at for a younger child, but even less than that for the youngest of children. Okay, so really aiming for 60 to 70 decibels as a maximum exposure. And there are apps on your phone that you can do that you can use to measure the decibel levels in your environment wherever you are. It just kind of turn it on and show you a running number that tells you what the speakers are picking up, so you can know right away. Okay, now as far as just like even using earphones, because let's face it, especially as our kids get a little older, we have our kids using earphones to watch their movies that they're watching on their iPads, and certainly as adolescents and older, they're listening to their music. Okay, but if you have a music that's coming in a concentrated way, if you have it over 70, that could be all the time enough to cause problems. Okay, but if decibel levels are over 100, even for a few minutes, that's enough to cause hearing damage. Okay, and if it's over 120 decibels, that can cause instantaneous hearing damage. Okay, that's why it's important if a kid or for an adult, because we shouldn't be exposed ourselves, whether we're going to a sporting game where there's lots of crowd noise or concerts, etc. Using sound canceling, like even like ear technology, like earplugs, and now they make ones that are specific for like going to concerts, so it doesn't muddy the sound. It just serves as a filter to lower the decibels, but the clarity of the sound of the lyrics will still be there. I don't go to a concert anymore without them myself, for all I know, for everything on all the Grateful Dead shows that I went to back in my 20s without hearing earphones. That's I used to have wonderful hearing, and now I don't have as good hearing anymore. So yeah, did it to myself. with the best of us, but hopefully we can prevent these types of things for our children. Okay, but now, as I said, it's not just the actual volume, but how long and for how often. Okay, now in terms of this new information regarding sleep machines, okay, and as I said, because the youngest of children are the most vulnerable to damage, okay, now this is what the Academy of Pediatrics actually just came out saying. What families may not realize is that children are exposed to potential harmful noises from infancy, and the effects are cumulative over the lifetime. So again, not just talking about at nighttime, but that. Now, a couple rules of thought. Okay, first of all, if something is too loud for an adult, it is definitely going to be too loud for a kid. Now, if you do need to raise your voice, whether it's with a sound machine or anything else, when a kid is present, if you need to raise your voice for your child to hear you over the ambient noise, there's too much ambient noise. You shouldn't have to do that. Now, in terms of in the more nursery settings, and like even if you go into a NICU, where it's usually very quiet, okay? And in fact, nurseries try to make sure that any of the bells and windows that their kids are not, and these premature babies are not being exposed to decibels greater than 50, which isn't a lot. But it's very common usually in ICU, in the neonatal ICUs, because it is quiet unless there's some emergency, of course, going on. Now, in terms of that, most sleep machines will go above 50, okay? But it is really best to make sure that the decibels is not exceeding 50, standing at least, and it's at least 7 feet away. So if the child's bed is you want to make the sound machine be at least 7 feet away from their bed if possible, but also put like your phone app or whatever right by where your baby's head would be and see what kind of decibels are coming off. Most of them do have adjustable sounds, but if you're pushing out there those types of numbers above 50, you got to take it down. Okay, don't be putting your child's hearing at risk for that. Okay, now so always and do that. Often. You never know. Some kid crawls over and changes the setting or whatever. So do check it regularly. Don't just set it once and be done with it. Every week or so, every day if you want before bed. Not that often. Check it to make sure that you're not doing anything unintentional. Okay. Now, also another thing, coming back more to the more broad picture with kids. Okay, earphones. In general, if you can hear the sounds that are coming off of earbuds or earphones, it's too loud. So you on the outside, not if you're wearing it yourself, but if your kid's wearing it and you're hearing what's coming out, it's too loud. They got to turn it down. Okay. Also, your child should be able to hear you when they're wearing earphones or earbuds. Okay. If they can't, again, the sound that's coming into their ears too loud, they should be able to hear you. Okay. Now, also, as far as the, some back to the sound machines, though, there are some that will have actually numbers of settings internally or don't allow you to go over. So if you're not sure that you're going to be able to check it properly, maybe even getting a sound machine that is, doesn't allow go for more than 50 or has some kind of more difficult way, not just a knob that you can turn it down or turn it up. Okay. Now, of course, there may be even a warning label on there that tells you they do that. But my feeling is if they're putting a warning label on there, that means they know something and just maybe they should make it that loud in the first place. Okay. Now, what is the main concern about hearing loss, especially in infants and toddlers? Speech delay. Okay. So that is one of the things that you should be looking for. So of course, parents, when we take our kids to the pediatrician and we go through the developmental questionnaire, is language progressing? Right? Is a kid hearing 1 to 2 words, or saying 1 to 2 words by the time they're a year? Are they putting words together and combining by the time they're 18 months into 2 years? If they're at speech delay, that for sure is an ongoing sign. Of course, if a kid is saying huh or what, or asking you to repeat themselves, that's a concern. If you hear a child speaking loudly, it may sound normal to them because you hear yourself talk, but if they're talking loudly, that may mean that their hearing has been blunted, and so they're producing the sound that they think that they should be making. Okay. Now, of course, if they don't react to noises at all, that's a big time concern. That should be evaluated completely. But also, if you're getting complaints that doesn't from the teacher, your kid's not paying attention, not focusing, doesn't seem to be paying attention, or if your kid says, I can't hear the teacher, that's why my grades are failing, then of course that's another sign of hearing loss. And all of those things should be evaluated. But at the same time, although there is hearing loss that can happen congenitally, genetics, all kinds of things like that. And yes, there are rare infections that can cause problems there as well. But really, if that's not the case, unless there's a developmental delay that's causing speech delay. If there's a problem with the hearing itself, it's probably because of what they've been exposed to. So let's try and not let that happen. All right? Hope you have a great day. Bye-bye.